iGlaucoma presents podium presentations on Glaucoma Rewind for national presentations that were missed or those you watched but wish you could press rewind and watch again. In today's podium presentation, the talk was presented at the live American Academy of Ophthalmology 2022 annual meeting in Chicago, delivered virtually. The presenter was my mentee, Eastern Virginia medical student Anna Dickinson.
Glaucoma is one of the leading contributors to blindness worldwide. Currently, the mainstay of glaucoma treatment is to control intraocular pressure. Intraocular pressure lowering methods range from ocular hypotensive medications to lasers to more invasive techniques such as surgery. Recently, an innovative non-incisional device known as Micropulse Transscleral Cyclophotocoagulation, otherwise known as Micropulse, has been changing the landscape of glaucoma treatment. Micropulse uses a diode laser to deliver energy in repetitive cycles to the ciliary body epithelium. This treatment disrupts aqueous humor outflow and thereby reduces intraocular pressure. Several prominent recent studies have reported on Micropulse as a moderately effective solution for intraocular pressure control and medication reduction. However, current literature is limited in its evaluation of the safety and efficacy of Micropulse within minority and underrepresented races. The purpose of the study is to evaluate the clinical outcomes of Micropulse in reducing intraocular pressure and ocular hypotensive medications in African American adults with primary open-angle glaucoma. This study was designed as a single-surgeon retrospective review of African American adults treated with Micropulse between the years of 2016 to 2022. We required a minimum follow-up period of 12 months in order to assess Micropulse's long-term efficacy. The data we collected included topical ocular hypotensive medications, intraocular pressure, best-corrected visual acuity, complications, and any secondary surgical procedures. The time points we evaluated were at baseline, 1 week, 1 month, 6 months, and 12 months. Preoperative ocular and demographic characteristics such as age, sex, ocular laterality, and glaucoma severity were also recorded. We defined success in this study as an intraocular pressure of between 6 and 21 millimeters of mercury, or a 20% reduction in intraocular pressure from baseline. For our cohort, 50% of the population included females and 50% were males. Our average age was 70.1 years, with a standard deviation of 14 years. Additionally, 77% of our population was comprised of severe staged glaucoma patients. The results of our study showed a significant reduction in intraocular pressure across all of our time points, as shown in the top figure. Intraocular pressure decreased immediately following surgery and remained steady with an intraocular pressure in the mid-teens over time. From baseline to 12 months postoperatively, our results showed an intraocular pressure reduction from a mean of 23.5 to 15.9 millimeters of mercury, a 32% reduction in total. Additionally, we saw significant changes in the number of ocular hypotensive medications, as shown in the bottom figure. The mean number of ocular hypotensive medications required decreased from 3.2 at baseline to 2.6 after 12 months. We also evaluated the safety of Micropulse. Visual acuity remained stable across all time points in our population. Additionally, adverse events were typical of those undergoing Micropulse as seen in other published studies. These events included prolonged inflammation, hypotony, and mydriasis. Of the 74 eyes that were included in this study, 6 required a repeat treatment of Micropulse and 7 required a secondary surgical intervention. In conclusion, the results of our study showed that Micropulse in African American adults with glaucoma is a safe and effective treatment option for reducing intraocular pressure and ocular hypotensive medication burden. However, we recognize that there are limitations to the study due to its retrospective nature. Moreover, the decision to modify a patient's medication regimen was based on the discretion of the single treating physician. The clinical relevance of our study is that, to the best of our knowledge, this is the first time that clinical outcomes of Micropulse have been evaluated in a solely African American adult population. We plan to continue to build on the study to assess the effects of micropulse and other microinvasive surgical methods among underrepresented populations. We hope that these methods will further elucidate the best individualized care treatment options for all glaucoma patients. Thank you.
Hey, want a must-need glaucoma tool that you can download right now? Well, check out my post-operative MIGS management strategy guide. It's a step-by-step treatment roadmap for routine MIGS cases. Look for the link in the description box below. Want more videos like this? Check out the iGlaucoma YouTube channel library. Check out the upcoming Season 2 of MIGS Success Surgical Secrets, where a video of common challenges and solutions will be featured. Subscribe to the channel so you won't miss it. Thanks for watching the iGlaucoma YouTube channel, a place for glaucoma innovation made easy for eye care professionals.